appreciate it, and thanks to the witnesses for their testimonies today. While I appreciate the intent of this hearing to focus on workforce issues within our healthcare systems, and in particular the inclusion of a bill that I've co-sponsored, the Dr. Lorna Breen Healthcare Provider Protection Act, I do want to speak to some of the broader significant challenges we have been seeing during the pandemic amongst our hospital systems, nursing homes, assisted living facilities, and other providers. And I wonder if we're missing a real opportunity to do more to address these challenges. For example, the Florida Hospital Association and Safety Net Hospital Alliance of Florida recently commissioned a report with projections from the healthcare workforce in my home state of Florida, which found that if the current trends hold up, by 2035, the state will be short of supply by more than 65,000 registered nurses and 26,000 licensed practical nurses, and that was using the 2019, actually, year 2019 as a baseline, not counting the potential worsening effects of COVID-19, the pandemic. Even now, one of my local Tampa area hospital systems, Advent Health's West Florida division, has told me that they currently have 1,022 RN openings, and it's not getting any better. Unfortunately, it's not unique to the hospitals alone, as other providers are also seeing their demand pushed while their supply is stretched extremely thin. In the mental health space, SAMHSA has estimated an over 4 million provider shortage of behavioral health services across the country. Very unfortunate. Amongst our nursing homes, 94% nationwide are currently facing staffing shortages. And the problem is only being exacerbated, as you know, by the pandemic. We must continue to do what we can to ensure we're supporting clinical education and training, increasing facility, faculty, of course, and clinical sites for nursing programs, and allowing for additional flexibilities in our current workforce incentive programs across the system. I believe this is all a nonpartisan issue. We all agree on this. In that vein, I was very glad to see Governor DeSantis sign legislation this summer that created a personal care attendance program with new entry-level position opportunities for these types of caregivers to count towards nursing assistant requirements in long-term care facilities, along with a path towards a certified nursing assistant careers. This is thinking outside the box. This is what we need, flexibility. We need innovative ideas such as this to ease the burden toward industry by making it attractive for individuals to enter into the workforce with a robust support system to grow our labor supply. Another way we can ease this burden is by reducing the demand. So I have a question to my friend originally from the state of Florida, and did an outstanding job as Department of Health head under Governor Bush. Very innovative ideas, and we did a lot together. I served for 8 years in the legislature while he was there, doing an outstanding job on behalf of the great people of the state of Florida. So, Alan, Mr. Levine, you mentioned in your testimony the importance of deliberately working towards admitting fewer patients and lowering inpatient hospital admissions by moving towards outcomes-based care at Ballad Health. I could not agree more that we should be promoting value-based care centered on outcomes, which is what Medicare Advantage does so well. Can you tell us more about the ways you think we can not only increase the supply of the workforce, but also specifically reduce the demand for these services?
Well, Congressman, it's great to see you again, my friend. And I want to go back to one quick thing that Congressman Griffith said earlier. He was referencing Rocky Top. I do want to point out I am a Florida Gator. But your question is right on target. All of these movements towards value-based and risk-based payment for health systems incentivizes us to find a lower cost way of delivering care. For instance, Ballad Health was just approved for our new hospital at home program that we're going to trial with CMS, because we learned during the pandemic, if we were able to take care of people at home based on certain criteria, we kept them out of the hospital, and that took the burden off the nurses in the hospital. And that happens with telemedicine and the use of technology. We're going to be moving in that direction. Anything we can do to avoid an admission to a hospital is helpful in reducing the burden on nursing staff in the bedside setting. It doesn't diminish the need for healthcare manpower in different settings, but it does diversify the healthcare manpower that.
Very good, thank you, and it's great to be a Florida Gator. Appreciate that, and I think we have a shot against Georgia this weekend. I know it's a stretch, but I'm always confident. I'm the eternal optimist. With that, I'll yield back. Thank you.
You always are, Mr. Bilirakis.